Thank you again for joining us for the Oli Foundation webinar, Coping with the Holidays and All That Eating. My name is Andrea Guidi. I am the Executive Assistant for the Oli Foundation. Most of you are probably familiar with the Oli Foundation, but just in case this is your first experience, I'd like to briefly introduce the organization. The Oli Foundation strives to enrich the lives of those living with home nutrition support, both intravenous nutrition, sometimes called HPN or TPN, and tube feeding. We do this through education, outreach, and networking. The Oli Foundation was founded in 1983 by Dr. Lynn Howard and her patient, Clarence Oli Oldenburg. Today, we serve approximately 17,000 members. All of our programs are free of charge for patients and their families. First, a few housekeeping details. You should see a toolbar on the right side of your screen. Click on the orange arrow to show the control panel. In the questions section, you can type any questions you have for me or for the presenter. Please note we will not be responding to the hand-raising function in the control panel. We will answer as many of the questions as possible during the questions and answers period at the end of the presentation. We'll post a recording of the presentation and handouts after the webinar on the Oli website. Please note that we have muted all of the participants, so you don't need to worry if there is background noise where you are taking the webinar. If you are having technical issues, please go to the Citrix website at the address on your screen. Now for the presentation. It gives me great pleasure to introduce today's presenter, Emma Tillman. Dr. Tillman is a clinical pharmacist in the Pediatric Intensive Care Unit at Riley Hospital for Children and has extensive experience in nutrition support. She obtained her Doctor of Pharmacy from Butler University, completed a pediatric pharmacy practice residency and fellowship in nutrition and metabolic support at Le Bonheur Children's Hospital and the University of Tennessee. She earned her PhD in cell biology and microchemistry from the University of Tennessee Health Science Center, where her research was focused on mechanisms of liver injury associated with TPN. In addition to having a professional tie to nutrition support, Emma has been a TPN consumer for the past 6 years. We are thankful to have you presenting today. Emma, I will turn over the presentation to you now.
Thank you. Wait just a second till the slides kind of click in. All right, and can you see my slides without the toolbar, or is the toolbar showing too?
Yes, you're good, Emma.
Okay, perfect. Well, thank you so much for letting me speak with all of you today. I'm excited to get to share my take on surviving the holidays and all of that eating. So it's really hard to stick to any kind of special diet. And I think for those of us with parental nutrition, it's even harder because most of us with parental nutrition and enteral nutrition consumers, we're often prescribed special diets that restrict us from normal foods that we usually would enjoy. So compliance is often a challenge, and we often get challenged with wanting to eat things that are not on our prescribed diet. And life is really centered around food, and this is even more apparent during celebrations and holidays. So this is probably a typical thing that you'll be seeing in the next couple weeks to months, where you have a lot of big family social events centered around a big dinner. So here you see a nice happy family, and again another like Christmas holiday party. You see the tree in the background, but a lot of the whole party is really centered around food. Here, people are getting together, catching up over pizza. Another party centered around food. And then a lot of times in the workplace, you have a lot of special things around the holidays. So more holiday luncheons, or people are bringing food into the office. So even in your work life, you're going to have to deal with more food challenges than maybe you would normally have to. And then as people are coming home for the holidays or traveling, you may meet up with old friends. So you're meeting up to chat with old friends, catch up over coffee. And then think about all of the gifts that revolve around food. There's a whole industry of like baking special things for people or gifting a lot of different food items. So food is super apparent. Well, food is not always our friend. This may evoke a lot of anxiety for the home parental nutrition or home enteral nutrition consumer. Eating can lead to pain, discomfort, and then urgent needs for visiting the restroom, and all of these can provoke unneeded stress. And then also not eating can spark numerous questions. So today I'd like to just share kind of my thoughts on some things. So I'm going to discuss the emotional impact of dietary restriction, talk about the complications with disclosing dietary restrictions, illness, and or disabilities, and how that will affect people, and then give some potentially some helpful tips to navigate some eating challenges, especially during this time of year. So some of the factors that are associated with dietary compliance include hunger versus craving. So are you really hungry or are you just craving that? So is it really that your body needs food or you need to eat something, or is it just that like that cookie looks so good and you really want to eat that cookie? And so kind of understanding when you're really truly hungry versus when you're craving a food can have potentially help you better navigate like actually giving into those cravings versus true hunger. So also eating at home versus away from home. So at home in your safe zone where you know where you can get to the bathroom quickly and you know which foods you can potentially eat without any struggle are going to be very different than if you eat at a restaurant where you're not sure of the ingredients, you're not sure how far the bathroom is going to be, is there going to be a line at the bathroom? All of these things can really affect how you're going to eat. And then social or peer pressure. So it's really potentially easy to eat in your safe zone where with your immediate family that understands your struggles with food. But when you're out with peers or in the workplace, sometimes this can definitely influence your impact your ability to stick with your diet. So in a study in 2010, Marion Winkler interviewed 24 adults with short bowel syndrome, and they wanted to evaluate the quality of life. And they looked at how their lifestyle was affected by their short bowel syndrome. And lifestyle was affected by health, stamina, diarrhea, having an ostomy, and an infusion schedule of parental nutrition. And the overwhelming majority of these patients had a strong desire to achieve normalcy in life. And so you think, well, what is that? What does it mean to be normal? But I think that's something that all of us strive to be like our peers, and you want to be able to eat and in a normal fashion and be similar to your peers in the way you do eat. So if you look at this family, I showed this earlier, it appears to be very happy. But if you think about this guy here, he's sitting at the table and he may be thinking, I want to eat so bad I can almost cry. So, maybe he is a tube-fed patient and he can't eat by mouth. And he's here at this, enjoying his family, and he's very happy to be here with all of his family. But he might really want to eat that turkey, but he knows that he really can't. So, how do you deal with this? So, one thing that you can do is eat or infuse your nutrition prior to the party. So this will actually combat your hunger. So if you do your parental nutrition or enteral nutrition, your body will be nourished prior to the party. You may still have those cravings. So that's something that you may still really have the desire to eat that turkey or eat that cookie, but your body won't be physically as hungry if you do provide it the nutrition. Not that this is a perfect example, and even with parental nutrition, you can still be hungry. I understand that, but sometimes if you do go to those steps to try to circumvent the hunger by actually fueling your body before the party, that helps a lot. Also, offer to help with the cooking or do something to distract you that you can still be involved with the food and with in the social situation, but you're not actually eating. And then bring your own safe food. So if you know that you can drink ORS solution or that you're pretty good with coffee or whatever it is that that works for you, bring that and have that with you and still participate in the party and have something that you can do, but maybe stray away from eating those foods that are not going to work out so well for you. So here's another example, and this little girl here is saying, I want to eat cake, but like the other kids, but I don't want my belly to hurt. So I think this is especially challenging probably for parents of young children. So this probably in this situation, this is more of a family setting, but what about when your kids go to school? How do you disclose their eating issues? In 2006, Sabrina's Law mandated disclosure of severe food allergies for school-aged children. And then in 2008, they conducted a study where they interviewed children and their parents, and children were actually stigmatized as a result of this disclosure. So there's a true conflict between physical safety and the social well-being. So with many of us, we don't have particular food allergies where we're actually have the potential of dying if we do eat a certain type of food. But there are certain challenges where some children may not be able to eat food that's brought in by their classmates, or they may not be able to eat food by mouth at all. And so these are some true stigmas that may be a problem for children in the public school system. So what do you tell the child? The child clearly understands that if they eat the cake, then their belly might hurt. So just be prepared to talk to them. So talk to children about what may happen if they eat the cake, but let them make that decision. So if they do eat the cake and their belly hurts, then they know what happened or what was potentially going to happen, but don't just withhold it from them unless it's really going to physically make them gravely ill, where they if they have some circumstances. But if just like an adult, sometimes I know that I'm going to have a consequence if I eat a certain type of food where, my stomach's going to hurt or I'm going to get sick afterwards. But sometimes you have to make that decision because sometimes it's worth it to eat that food. Pack safe foods for the child. So if the child really shouldn't eat concentrated sugar or some type of food, is there something that they can eat? Is there some type of food that you can pack for them that would be their own special treat when the children at the birthday party have cake? What could they take that they could have in replacement? And then communicate the special nutritional needs with someone that's going to be with them. So if this is at a school party or at their school or at another classmate's house, let an adult or someone supervising know this is what's going on with my child. So then someone can be there, kind of their eyes and ears there, and help them navigate the whole situation. So some situations are unavoidable. Every day we're encountering business lunches, job interview meals, conference activities, and sometimes you have to be participating in these kind of things. You may not have to eat, but it may draw more attention to not eat. So this is a good example of something that might be happening around this time of year, a big holiday luncheon at your office. And so you walk into the office and everyone's getting their plate for food, and this lady's saying, I'll put some food on my plate and move it around, and maybe no one will notice that I'm not eating. And I have to admit, this is a tactic that I use quite frequently. So successful employment with disabilities. Now, many of us don't like to think of our need for parental and enteral nutrition as a disability, but in some instances it really is. It's something that makes us uniquely different, and we have special needs that are different from those from our peers. And so individuals with disabilities face barriers to employment. And investigators interviewed 41 people with competitive employment for at least the past 5 years and discussed their disabilities. Disclosure and discussion decisions were influenced by their disability. And people with disabilities also must work harder to get a job than those without disabilities. And I think those with physical disabilities where you can see, probably this impacts them a lot more, where I feel like with the need for parental and enteral nutrition is somewhat more of an invisible illness that we can kind of decide how much we want to disclose. But that's definitely something that you need to consider in the workplace. So going back to this lady's statement, I'll put some food on my plate and move it around a little bit, and hopefully no one will notice I'm not eating. Well, you need to decide how much or how little you want to disclose and with whom. So do you want everybody in your office knowing that you are on parental nutrition or enteral nutrition? And if you do, that's fine. That's you're welcome to that. But if you want to be a little more discreet about it, that's also your preference. So you may be doing a little bit of acting in order to kind of seem a little bit normal. And then, but you do need to communicate with someone. So is that, the person that's at the desk next to you, or is that one of your good friends that works down the hall? Someone needs to know, just in case there is some sort of situation where something happens. Someone needs to know that you do have some needs that are different than those around you. And then I think it's helpful to have a wingman. So kind of just like in the dating world, you have someone that kind of can run interference. So I've worked in the professional world, and I've had many of these circumstances where I've decided I'm not going to eat. And, when you don't eat and you're not fixing your plate, everybody's like, oh, go fix your plate, go ahead of me. And sometimes it's nice to have a wingman where you can say, oh, no, I'm full, I'm fine, I've already eaten. And then if somebody else is pressuring you, someone else can kind of interfere and say, oh, yeah, Emma, didn't you tell me that you already had a big breakfast this morning and that's why you're not eating or something? And just to kind of like take the pressure off, and not to lie about it or whatever, but sometimes if you open the door and you ask for a ton more questions than you really want to address, especially in your professional life. So having someone there that does know, that can kind of run interference if things get a little bit too involved is really helpful for me. Avoid conventional eating should not make you avoid your friends. So social withdrawal is typical reaction of someone who's working through a new eating restriction. And avoiding social food interactions may make you feel worse about your situation. So this is something we truly want to avoid. So going back to the situation with the girl catching up over coffee, this girl here saying, I'm just going to hold this cup up and maybe nobody will notice that I'm not taking a drink. And then her friend sitting here saying, Liz has been holding that cup, but she hasn't had a drink yet. I wonder if she's okay. So here, this situation, the one girl thinks she's like, kind of being low drama, just pretending like things are fine. But these are her true friends, and they realize something's up. And so here, it maybe it's better to tell someone. So to tell or not to tell, I think you need to be honest. Eliminate the assumption. So don't make people assume that something's going on, or they may be assuming something way worse than what is actually going on. Communicate what makes you comfortable. So typically, if I'm going to lunch with someone, or somebody says, "Hey, would you like to go to lunch?" I may say, "Yeah, but I'm probably just going to get a drink. I don't want to make you feel uncomfortable. I probably won't eat anything, but I'd love to go to lunch and visit with you over lunch. And it's not going to bother me at all if you eat and I just have my drink." And for me, that really works well. I think that takes the pressure off the other person. They don't feel like they're going to be like it's going to make you sick if they're eating in front of you, or make you feel uncomfortable. And for me, I don't mind that. I would rather just sit there with my drink and be comfortable, or maybe not even have a drink at all, but just be able to visit with someone. And if it's during their lunchtime and they want to eat, it's not going to bother me at all. So sometimes just taking that chance to be honest and putting everything out there, it will help facilitate things a little better. And then your true friends will care more about you and your well-being, and they'll be supportive of what you want, and they want to help you. And then avoid unnecessary drama. So it's fine to tell, give people enough information, but don't make it all about you. Don't make it, woe is me, I can't eat anything, I'm so sad, I can't have any food, I'm missing all the holidays, you're so lucky you get to eat, I can't. People are going to get real tired of that really quick. And there are some people that you're going to want to vent to that, and you're going to have your very close friends or your family, and there's a time and place for that, but you can't be that person that has that unnecessary drama with every situation around food, because then I think then people will pull away from you, and it will just be a very uncomfortable situation. Not that you can't have drama, because we all have drama in our life, but no one wants to be around someone that's very negative and very down and all about drama with everything. So dating, yeah, this is challenging with anyone, but definitely dating with eating challenges is very, very challenging. So first dates can be stressful enough without food challenges. But one of the best things is just to have a game plan. So be prepared. So here, they're out here going out for pizza, this girl and the guy is saying, "Oh, I hope there's no line for the restroom," as he's eating his pizza. And so, how do we prepare for this? Well, know your environment. Try to pick a restaurant or coffee shop that's familiar, so you do know where that restroom is. Maybe if it's a one-seater or a two-seater, or how far down the hallway it is, or do they have multiple restrooms? Choose a safe food. If you know that every time you eat Thai food, it's going to be bad news, well, don't go to a Thai restaurant. Or if you know that, if you eat anything, then it's not going to be good, well, choose something that doesn't have to do with food for your first date. And then decide before meeting how much or how little you want to disclose. So do you want to tell people, everything about your illness? Do you want to just tell people, I have kind of a sensitive stomach, I don't really like to eat a lot, in public, or do you want to just, kind of play it cool and just sort of do your best to not disclose anything? And I think all those are fair options. And as different relationships progress, and this is with, with dating or with just friend relationships, I think things evolve. And so usually on the first date, you're not, or the first meeting of someone, you're not kind of like, here's my life story, let me tell you all the things that are, show you all my dirty laundry. But as, you get closer with people, you may feel the need to, disclose more to them as time goes on. So food gifts. Food is often given as a gift to show gratitude or appreciation for someone. And then sometimes not eating the food can be seen as disrespectful or ungrateful. So, here we show all these great food gifts that you see around the holidays, and this girl is like getting this pie, and she's like, thank you. So for food gifts, be grateful. People are really trying to show you that they appreciate you, and that's why they're giving you this gift. Don't be offended that someone hasn't considered your relationship with food when they gave you this gift. Your situation is really not the norm, and it's very difficult for people to comprehend. And even my friends and family, people that are very close to me, sometimes forget that, that giving me some sort of food gift is probably not the best gift. We all enjoy food, but sometimes it's not really always the best option for us. But they don't mean it as disrespectful. They just mean, they're trying to show appreciation and doing what is sort of the cultural norm. So your true friends and family will accept you and your eating challenges. So be honest with them. Avoid any unnecessary drama. You're going to have those moments where you want to have some drama, and that's fine. But just, try to keep it in check. And then here, going back to this table, this lady saying, it's so nice to enjoy a meal with my family where I'm not judged for what I do and don't eat. And I think that's what we all strive for. We want to be able to, eat what we can and feel comfortable, but not be judged. And I think this can go on both sides, where some of your closest friends and family may know that you have eating issues, and they may say, like, oh, should you really be eating that? And maybe you know that you shouldn't be eating that, but sometimes you want to take that risk, and you want to take that, that's your prerogative to choose to eat this big Christmas dinner and know that you may be sick the rest of the day, but it was really worth it to enjoy that. And sometimes it's really good just to have people that appreciate you for who you are and don't judge you on that. So friends and family, you can go to and enjoy their company with and without the worries of food. And then also try to enjoy activities that don't involve eating. Try to start incorporating some non-food traditions into your holiday celebration. So maybe this is a craft. Maybe each year, instead of bringing a side dish for your holiday thing, maybe you bring a craft where you can teach everyone how to make a certain type of holiday ornament, or do some sort of centerpiece, or something where you're distracting the attention away from the food, and you're doing something else that makes it continues the tradition, and it's something where you're engaged in the activity, you're very social, but you aren't participating in the whole food scene. And then think about your safe foods. So here's a few of my safe foods. Gummy bears are always a safety for me. The opaque coffee cup is a winner for me. So even if I don't drink out of it, it's something that I look very social because I'm carrying this coffee cup. And then, everybody has their own yogurt, bagels, mac and cheese, turkey sandwich. Those are a few of mine. But everybody has sort of their safe foods that tend to work okay, or at least they're predictable of the way that you know what's going to happen. So try to keep those with you. And you may not be able to eat the greasy burger out with your friends, but maybe you can, munch on a few gummy bears and have a Diet Coke, and you're still being social. And then be prepared for the worst. You may want to keep a spare pair of panties in your purse, or a puke bag in your car, or you may have some meds that some anti-nausea meds or diarrheal meds, or something that that can help circumvent some of your symptoms if you do have a bad encounter with some food. So at this point, I will open it up for a discussion from the audience, and hopefully we have some good questions. And then I invite you to also read a little bit more. Carol Ireton Jones and I wrote a commentary, kind of the same sort of themes that I went through in this presentation, but more in a formal setting, kind of urging clinicians how to talk to their patients about food-centered issues. So that reference is there for you to consider. And I will, I guess I'll throw the slides back to Roz then to throw up the questions.
Sure. Thanks, Emma. Great. All righty. Thanks, Emma. Now we will begin the question and answer session. If you haven't already done so, feel free to submit your question in the question section of the toolbar on the right side of your screen. We'll do our best to answer as many questions as possible. Okay, I do have some coming in, Emma. To start with, how can you let other guests know not to push food on a G-tube dependent person?
That is a great question. So that kind of goes back to my example of having a wingman. So I think it's great to have, I think you can be your own advocate, but sometimes it gets exhausting being your own advocate. So if you have someone there, if that's your husband, your sister, your brother, or your mother, a mother of a child, and saying, oh, remember they get their feeds by the G-tube, they don't need to eat by mouth. And just, somebody else just to remind them and keep it playful, not shaming the person for not remembering, because it's different, and people have sometimes a hard time comprehending, like, oh, you mean they don't eat anything by mouth? Like, don't they get hungry? Don't they want this? And so I think it's just trying to keep reminding people that, yeah, they Aunt Sally, remember, Katie doesn't need to eat anything. She gets her feeds through her tube. Because sometimes it just takes a while. So I think definitely having a wingman or a couple wingmen, a couple people that are close to that person that can kind of run interference. So then when they're saying, oh, please try my famous potato salad, you can say, oh, that I'm sure it's great. It looks wonderful. But I just finished my tube feed, so I'm completely full, and I can't really eat that right now. And not to shame the person for forgetting, because sometimes they clearly forget, and sometimes it doesn't click with them. So I think definitely having as many people run interference for that works well.
Great. We have another one coming in. How do you handle a situation where you are at a function and begin to feel poorly? Do you go home or ask for a quiet place to rest for a while?
Yeah, that's a great question. I've done both. So sometimes I've left early. So, I may, this happened this weekend. I went to a party at my neighbor's, and I knew it was not a great day, but I wanted to make an appearance. I wanted to see my, some of the neighborhood people, and I knew it wasn't because I ate, like there, I didn't actually eat, but I wasn't feeling well to start, but I wanted to make an appearance, and I wanted to be social. So I went and I said hello, and I visited with people for a little while, and I was like, oh, I'm so glad I got to see you, but I really need to get out. I have a big day tomorrow, and I need to rest. But I was so glad. I'm glad I could come for just a while, and I'm so happy that you invited me. And I think people don't feel, they don't think anything of it, because people are busy around this time of year, and if you're in and out going to other parties. Now, I've had the other situation where you've been so sick that it's really hard to get home. So I've had to, I've went into the bathroom or asked, do you have an upstairs bathroom that I could use? Is there a place where I can just, hang out for a little bit? I'm not feeling quite well. And, you want to do this in kind of a low-key way, because you don't want to put undue stress on the person that's hosting the party, or make them, feel like they need to take care of you or in any way. But there's sometimes where, you physically just can't drive home, feeling pretty poorly, or you need to wait till things kind of pass a little bit. And I think you can do it either way. And I think your true friends are going to support you in any way they can. And I think a wingman in this situation helps too. So if you come with someone else, or if there's another close friend there, and you say, hey, I'm really sick. Is there any way you could drive me home? I hate to do this and pull you away from the party. But most people will respect that, and they'll realize that, you didn't plan to get sick, and you didn't, you're not trying to get attention or whatever, and they're going to help you out. So I think all of those things, you just kind of have to play it by ear and see what works best. But I think don't stress too much about it. If you go to a party and you're not feeling well, then go home. If you need to rest a little bit and then party hard again, do that, and just listen to your body, and your friends and family. If they're truly your friends and family, they'll completely understand.
That's great advice, Emma. We have another one. Regarding cooking, I am an RD on TPN, and cooking takes me and many patients years to manage. I found distracting myself through knitting or sewing at the table helps. Do you have an additional focus?
I think it's very personal dependent. So my sort of distraction from eating and a lot of eating events is I like to exercise. So when people say, hey, we should get together and catch up over dinner, I said, how about we catch up over a walk? Or how about we catch up over a run? And so I kind of take food completely out of it a lot of times, where I go and and walk with people rather than sit in front of a table. I've heard parents where of tube-fed kids where they will let them color at the table. So if they're getting their tube feedings, they don't have to eat, but they want them to be social and hang out with the family and have that family, that traditional family dinner and talk about your day. And so they'll bring them, their coloring book and crayons, and they can sit there with their siblings, and as the siblings eat their dinner and the parents, and they may fix them, for depending on the child, they may fix them a plate of food that they can nibble on if they can eat, but maybe they get most of their nutrition via TPN or tube feeding. But they keep that social part of food alive by letting them do something else at the table. So yeah, the knitting, that's not something that I've done before, but I think those are great things where you are present at the table, but maybe you're distracted from the food by doing something else.
Mm-hmm. That's great. I have one. I infuse constantly and find the questions annoying. How do I change the topic gracefully?
Yeah, I think it's that's I've done that before too. So I've been doing night TPN lately, but when I started my new job, I was doing daytime TPN, and I came the first day to my job working in a hospital with a backpack, which clearly had IV tubing coming out of it, hooked to me. But I think sometimes people didn't notice the tubing, and they would say like, "Oh, you can put your backpack in the break room." And I was like, "Oh, thanks, but it's attached." And then people are like, "What? It's attached? That must be a really expensive backpack," or something silly like that. But I think having a wingman helps in that situation too. So there was a girl that I met in the first few days of my job, and she had asked me, she's like, "Oh, you can put your bag in the break room," and I was like, "Oh, it's attached." And so she sort of took it upon herself to tell a lot of other people. She's like, "Hey, she's got this backpack, but don't ask her to put it down because it's actually attached to her." And so I think by her just doing that and telling a few other people that I was going to be training with or seeing the next few days that, like, hey, this girl has this backpack, don't, like, whatever. I wasn't being secretive about it. Like, I would tell anybody things, but people just didn't tend to ask questions if they already knew what it was. So word just kind of got around like, oh, yeah, that's the new girl. She just started here. She's on TPN. She has a backpack. And no one really cared. So I think, yeah, you're still going to get that when you're at the grocery store, or, the person that comes to the UPS man that comes to your door and be like, "Oh, are you headed out? You've got your backpack on," or, those kind of cute little things. But don't be annoyed about it. I think it's people are really concerned, or they're inquisitive about it. And think about, they're not trying to be mean or nosy. They just they're just interested. Why are you wearing a backpack? And maybe if the more honest you are about it, those questions can sometimes go away. So if you're like, "Oh yeah, I wear this backpack because I infuse nutrition. I do it all day. I'd be happy to answer your questions, but right now, I have to get to work. So Maybe we can schedule a time later if you have any more questions. Or if you don't want to get into it, just say, oh yeah, I have nutrition. I wear this backpack, and then just walk away. I don't think people mean to be rude. I think they're very interested in it. And you're going to have some people that are constantly, ignorant about it, and that's fine. But as you kind of get in your normal routine, people don't even say anything to me about it at all anymore. Or now sometimes when I don't have my backpack on, they're like, hey, you haven't been wearing your backpack. Are you still on TPN? Is that still going okay? And I'm like, oh yeah, I've just been doing it at night. And it's kind of nice that people even notice that. They're like, oh, she was on TPN and now we don't see it. I wonder if she's okay. So I don't know. I think just kind of look at it in a different perspective. Like they're really worried about you, and they're wanting to know if you're okay. And maybe if you think about it that way, it won't get so annoying.
Thanks, Emma. Another one, my biggest struggle, especially this time of year, is battling cravings. Everything always looks good, especially when you can't or shouldn't have it. Any tips on how to overcome cravings?
Yeah, I think if we knew that, we would all be cured, right? And there would be no obesity, and there would be no no we would all have perfect diets. So it's tough. I think indulge when you can, and make it a safe thing. So decide that, like, okay, I'm going to this party, and I know that Aunt Mary always makes her famous fudge, and I love that, and I've been dreaming about it for the past month. Well, have a small piece of that fudge, because you're gonna like beat yourself up if you don't. But don't go crazy. Don't take a take home plate and eat Aunt Mary's fudge for like the next 3 weeks. Or don't do that every day. But you have to live a little, and sometimes if it's not going to make you tremendously ill, sometimes bad decisions are okay, and you can eat something that's not perfect on your diet, and you may have stomach ache, or you may be spend the next hour in the bathroom, but that might be okay. Or keep it in perspective, like, okay, I really want to get through this party, or I really need to sit here for the rest of this, or I want to see my kids open their presents. So I don't want to be in the bathroom and miss all that. So I'm going to make myself a little plate, and then after the festivities are over for the day, I'm going to eat I'm going to eat this meal in the evening. And so rewarding yourself somewhat, but also keeping in perspective, and just consciously make those choices. Like, is this worth what may ensue afterwards? And then if it is, then eat it, and if it's not, then save it for later, or don't do it. I think some people use journaling. I had a journal sometimes that I keep, and it says all the foods that I want to eat, and sometimes it helps just to write those down. So like, as I'm thinking about all these cravings, I'll write down like, oh, chocolate chip cookies, whatever, like this page is full of stuff. And then you're like kind of like dreaming about it, and you have that there. And then afterwards you've like sort of like thought about it, and then you're like, well, if I had to choose one, which would I eat? And so sort of narrowing it down. So just silly techniques like that. I don't know that helps anybody, but for me, it keeps me busy, and it keeps me like distracted enough that I don't eat everything in sight. So maybe that'll help you a little bit.
Great. Emma, you kind of touched on this briefly in another question, but perhaps you could go more in depth. I am on 18-hour-a-day J2 feeds. Do you wear the backpack and continue the feeds, knowing it will elicit many questions, not to mention the fashion, or do you just skip the feed until you get back home?
I've done it both ways. My philosophy now is you got to own it. Get yourself a cool backpack and strap on your backpack and be a big girl and go to work. I think you're going to feel bad if you don't. If you don't do all your nutrition, you're going to feel depleted. You're not going to feel good. You're going to have more tendency to want to cheat on and eat something that you probably shouldn't, because you're going to be more hungry. Yeah, it may probe a few questions, but I don't think those questions shouldn't make you not treat your body well. So, you're supposed to be on a certain amount of nutrition, and that's what's best for your body. And just because you're worried about what others think, that's really a silly reason to not take care of yourself. And I've been in that place where you didn't want anyone to know, and you want to like pretend like you're like an in the closet TPN, person. I do this at home in my home life. People know I'm on TPN or I know I'm on J-tube feeds, but my work life and my public life, no one knows. And, I think that's okay. But for me, it was liberating when I just said, this is my life. Like I have this backpack and I have TPN and I go to work. And I think I was really, for a while, I was really worried about that it would make me look weak, that people would think that I couldn't do my job, that I was not going to be dependable because I had this, IV line and I had TPN or, if you have tube feedings or whatever. And my perception was that other people would see me as flaky and unreliable and not dependable because I was, had some sort of disability, sickness, whatever. And I think I experienced just the opposite of that. I think when I put my backpack on and went to work, people viewed me as strong. People viewed me as, this is somebody that deals with a lot more. Like for me to get to work in the morning, I didn't just wake up, get in the shower and throw my clothes on and go to work. I, took a shower, changed my dressing, hooked up my TPN. It took a lot more to get me to work that day. And they realized that it wasn't just I had this TPN or tube feed or whatever for just for show. There's a reason, they and I work in a hospital, so people know that, I have a lot of, bad belly days, as we call them. And for you to be able to strap on your backpack and go to work despite that, people don't view you as flaky or dependent on parental nutrition or enteral nutrition. As they don't look at that, down on that. They look at that wow, this person has a true struggle in life and they've strapped that backpack on and they're going to work and they're doing it and they're not letting things stop them. And I think I didn't expect that from people. And I've had physicians, I work, in a hospital, and I've had physicians come and say, hey, I don't know if I don't want to offend you, but is there any way I could talk to you about what it's like to be a patient? Because I'd really like to know from the patient's perspective how I can be a better doctor. And I was really just floored by that, that someone would really be that intrigued by it. But I think people really are. They see what we do, just living life with our obstacles as a really strong thing. And I don't think you should be ashamed of it. So that's just my take. But I think it's been really liberating for me just to have it kind of be all out there and really own it.
Mm-hmm. Emma, based on part of your presentation, is having TPN considered a disability in the workplace?
So I think I don't consider it a disability, but I think compared, based on the American Disabilities Act, it would be considered because it's something different than what the norm. So you don't eat by mouth, or you don't get all of your nutrition by mouth. So you have an extra, you may have a backpack with an infusion pump. So that could be considered under the Disabilities Act or whatever. It could be, there's a whole list on the American Disabilities Act of different conditions, and then it says or other. So I think depending on what your underlying condition is, it could fall into that. So I think it can be viewed in different ways. I have not had that perception. I've not seen people treat me like I had a disability. But I think some people have that misconception that they may be treated that way, and they don't want to disclose because of that. So I would urge you to at least tell your direct supervisor, just because you kind of need someone to know, just in case something goes wrong, just so someone that works with you realizes that you have some special needs. And you don't have to tell people everything, but I think it is really good to at least have someone in the loop in case something were to go wrong.
Great advice, Emma. We have another question. What's a good way to explain your feeding tube to young children who see the tube? I'm not trying to hide it, but want the explanation to be simple.
Yeah, so I think kids are so inquisitive, and they're so interested in it. And it's kind of like, for kids, they just sort of see it and they're like, oh, okay. So I have told my niece before, and I think she was she's 4 now, and I don't think it was until she was 3 that she actually noticed. And I would, change in front of her, or she'd see, she'd see it hanging out or whatever. And she's like, "What's that?" And I said, "Well, that's where I put some extra nutrition in, because I just can't eat enough to make me strong. So I have to put some extra nutrition in this little tube, and it goes straight to my heart." And she just said, "Oh, okay." So I think you can say that, about your G-tube, like, "Oh, sometimes I just can't eat enough to get enough to make me big and strong. So I need to have this special food that goes into this tube, and it goes right into my stomach." And most kids will just say, "Oh, okay," and that's it. Some of them may have more questions about it, but I think just being upfront and honest, kids are almost easier than adults to explain things to, because they just sort of take your word for face value, and then they're very honest about like what their questions are. So I've kind of found it easier to explain things to kids than I have to some adults.
Perfect. Emma, how would you deal with family that doesn't believe in your illness? It's hard not to eat, but if they think you're faking.
Yeah, I've not dealt with that personally, but I know that is a struggle for a lot of people, where their their family kind of pushes on them, like, "Oh, if you would just try harder, if you would just try to eat more, or quit being a drama queen," like, that kind of thing. I think I think you just need to do what makes you most comfortable. And I think the more you play into that drama of them not believing you, not whatever, the more stressful it's going to be. So whether that's, I think I would just approach it in a very honest way, like, "Hey, Mom, I realize that this is really hard for you to comprehend, that like things are not working well, that I'm not able to eat, but I'm really trying my best, and now I'm getting my nutrition via my G-tube, and it's I feel much better than I have in a long time, but it makes it very stressful when you always try to get me to eat, because that makes me more sick." And I think if if you can be very upfront and honest and say, "This is how I feel, and by you telling me this is making me feel this way," I don't think your family wants to make you feel bad, and I don't think I truly don't think a lot of people think you're faking. I think that they just don't understand it. And it's hard. It's hard when things aren't the norm, and it's really hard for people to comprehend. So I think, having patience with them, and if it gets really bad, you may need to just take a little bit of, have a little bit of a buffer. So, if it's your mom that's, pressing hard for you to eat, maybe your brother can kind of run interference and say, "Hey, Mom, she's fine, just, like, lay off a little bit," or, like, maybe you need somebody else to run some interference there. And, I hate to have you pull away from your family, because your family will be there for you. But sometimes if it's that stressful, and they're accusing you of faking your illness and that sort of thing, a little space might be helpful too. So, run some interference, have some other family members that you trust run that interference with you. And then, even giving them some literature. The Oli Foundation has a lot of literature about tube feeds, and, help them understand that just because you're not eating, you're getting your nutrition a different way, and that there's a lot of people out in the world that are dealing with something very similar, and that you're not an isolated person, and it's not a made-up illness. And, people, they'll come around, and they can get there, but sometimes they just need a little bit of help.
That's really helpful advice, Emma. Another question we have for you. I find job interviews to be really uncomfortable. I don't want to come out and say I have a GJ tube, and I'm often in hospitals for visits, procedures, etc., but I also want them to be aware of my situation. What is the best and most professional way to discuss this?
Yeah, I've had this issue come up too. Job interviews are challenging. What's helped me is I've usually, in positions I've applied for, I've dealt with an administrative assistant in scheduling things, so like they'll help with the flight or with your hotel or whatever. And so usually when they're scheduling things, many times they'll ask you, "Do you have any dietary needs?" And I've communicated with that administrative person and said, I have a sensitive stomach, and I don't like to eat. during a stressful day like the interview day, I probably won't eat. So is there any way I could have not have an interview scheduled dinner or like a dinner with people? I would be happy to meet with people, but is it possible to not have that in a dinner? And all of the time actually, when I've done that with the administrative people, you would be surprised. It's probably not that uncommon, because I think people even with non feeding tubes have sensitive stomachs and things that times of stress like a job interview, sometimes food does not do well. So I think going through that administrative person, so you're not telling them your whole life story, but you're saying, I've got a sensitive stomach. I don't really want to have like an interview lunch or a dinner with the search committee or whatever. And that's really worked well with me. So I've met with had different interview blocks, like one at 11 o'clock and one at 12 o'clock, and there's just not been an interview lunch. And that's been helpful. And then I think once you kind of get the job, then you can disclose a little bit more. Like, I just want to, when you go to work, if you have your backpack or maybe you don't have any like visible signs of it, meet with your direct supervisor and say, hey, I just wanted to let you know I have some GI illnesses. Occasionally I do have to go into the hospital. I have to have procedures, but I will always give you the heads up. It's not a problem. I won't, I've never exceeded my PTO, and I think, I'm sure that I'm going to be able to do this job. But there will be times where I'm going to have to last minute be sick, or I'm going to call in or whatever. So I just want to give you the heads up that this could occur. And I think most people, from my experience with having a couple different employers, they're very understanding of that, and they're willing to work with you as long as you're honest with them. So that's just from my limited experience, but it's always challenging with job interviews. But I think just the honesty and giving as much information as you need to let people know, but not giving as much information or giving so much that you're kind of bringing them into your, like, telling your whole life story on the first date or whatever. So.
Thanks, Emma. That's great. Another question coming in. I want to eat when I'm under a lot of stress. What tools are helpful for dealing with that? I have a lot of stress at work.
So I told a little bit earlier, like, I like to write down all the foods I wish I could eat. Sometimes I eat just like small things. So like some people chew gum or some things like that, where you're actually chewing, but you're not actually eating a lot. And then, maybe drinking more would help. I don't know. I think, that's not just for your tube fed or TPN dependent. I think that's everyone. When you're stressed or bored, you do want to eat. So I think, think about things that might work. Can you eat crackers without much trouble? Or can you eat, crunch on some ice? Or, are there things that you can do that kind of give you that crunchy or that whatever that helps with your stress, but isn't going to make you sick? And then are there other like non-eating activities that can take away your stress? So like for me, I do a lot of running. So after work, I typically go for a run, and that is sort of like a non-eating activity that can redirect my stress. And not that it makes me not want to eat or doesn't make me hungry or whatever, but it's just sort of redirecting it. And I think that's just a good stress management tool, is to do something else that distracts you from eating or from a behavior that you do to compensate for stress.
Mm-hmm. That's great advice. It kind of segues into the next question, Emma. How do you handle being hungry, starving rather, on a daily basis, as well as during the holidays with all the food around?
Yeah, I think so. None of us should really be starving, right? So if we're getting parental or enteral nutrition, we're really not starving, because we get our nutrition just a different way. So I think infuse or give your tube feed prior to the party or prior to all that food being around. Also, like, I think a lot of times I get confused. Am I hungry or am I just thirsty? And I think to check your hydration status. So a lot of times you can think that you're super starving, or you feel depleted, and you think it's hunger, but really it's just thirsty. You're really just dry. You just need a fluid bolus. And so maybe you need to give extra fluids, or you need to infuse your TPN or your tube feeds for a longer duration, or not not skip out on if you're supposed to be doing 18 hours, don't just do 8 hours and just do it, at home. So you may not actually be hungry. You may just need to rethink it. So, and it may be better to put your backpack on and go to that party, because if you're infusing and you're getting fluid or nutrition while you're at the party, you're probably going to have a lot less cravings because you're actually going to be fueled at the time, rather than if you infused overnight and then you go to work all day and then you go to a party at 6 p.m. and you're still there till midnight, and it's really time for you to start TPN, and you're like super depleted because you haven't had any fluid all day long. You're tired, and everybody around you is eating all this wonderful food, and yeah, you probably want to like eat somebody's head off. But it's not really because you're that hungry. It's just because it's time for you to start your nutrition. So if you can do your nutrition that you're prescribed, your TPN or your tube feedings, that would make those cravings a lot less.
Perfect. Emma, I think we have time for one more question. Have you ever had to ask for more PTO in an interview to account for any sick days? Advice on how to ask without discounting yourself from the position.
I have not asked that, but I have. I do explore with human resources, not typically the the person that's hiring me, but with the human resources, the sick time and the vacation time and short-term disability, and is there a sick leave bank, and all of those kind of things that can actually help facilitate that. And do they have FMLA and all those type of benefits package? I think that's easier to do with human resources because they can sort of do it in a non-judgmental way, and they don't have to know the ins and outs of your illness, and it's probably somebody that you won't ever talk to, on your day-to-day job. And, all those things need to be negotiated after you've already been given the job. And I think just like a pearl of negotiation, when you've been offered a job and you're in this negotiation stage, you really have the power because they've already chosen you and they want you for the job. So, you can ask for more. Now with PTO, a lot of large companies, they have kind of their standards. So you get, so many hours for the first 5 years that you've worked there, and then it goes up. So sometimes that's non-negotiable, but they may be able to do other things where you can have, time off without pay, or if maybe you have like only like a 2-month waiting period for a short-term disability, or you can do some sort of PTO buy-up if you are on short-term disability, where you can get your full salary or whatever. So there are other benefit options, but I think all those are just kind of go down to negotiating skills, and if they're not willing to work with you, then it may not be the job for you. And those are things to consider too, because not every job is going to be conducive for you to work there.
Well, perfect. I think we've run out of time. We will post answers to the rest of the questions on the OLLI website. These are a few pages on the OLLI website where you will find resources with tips from OLLI members on how to manage, reduce, or avoid holiday stress, along with tips on everything from holiday preparation to hospitalization. Thank you, Emma, for an excellent presentation. We appreciate you sharing your expertise with us. Many thanks to Shire for supporting this important educational program. Thank you also to participants for joining us. We'll post a recording of the presentation on the OLLI website in case you'd like to view it again. We hope you will join us for another webinar. To view our schedule of upcoming webinars and past recordings, visit the OLLI website at olli.org/webinars. That's all for today. Thank you and goodbye.